Guys, look at this question asked here. What is viral load? How is it used in HIV patients? So they've asked this for 3 marks. Viral load in general, you should talk about it. And then they're asking you how will you use this viral load in HIV patients. Okay. So let's get started with what viral load is first of all. Viral load means it is not specific to HIV that they're asking you. Viral load basically is the amount of virus in blood. So that is viremia, level of viremia you're measuring. How will you measure? You can say that you can use some quantitative PCR, etc., polymerase chain reaction to know how much of virus is there in the blood. What is the unit that you will give this reading in? Copies per ml. Okay. So in HIV, at least if it is less than 1000, it is good. That's what they are saying. Less than 1000 copies per ml is good for HIV. Assess the level of, so what will this tell you now that the report is out? It will tell you how strong is this virus and how much is it able to replicate? How is the disease prognosis of the disease? How is it? Is the drug that we have given effective? If the drug is effective, then possibly the patient is not adhering to the regimen. That is why the viral load is increasing. And if the viral load is high, that means to say this person can transmit it to others, right? So that is a risk. And this viral load you don't have to use only for HIV. You can use for so many other viruses, okay, like cytomegalovirus, hepatitis B, C, etc. One more thing is there, transmission risk, okay, from person to person or even from parent to child, right? Parent to child transmission can be there, which you have to think about. So it's not just sexually transmission or something. Parent to child transmission also you will have to think about, okay? So all this, it will help you understand the prognosis, plan, okay? You can plan the drug therapy to give, okay? So you can plan the therapy, right? Okay, so this is about viral load. Now let us go to HIV. Okay, so now HIV means what will you say? Same thing only you will repeat, but with some more specific data. So HIV, if somebody has, what will you give them? Antiretroviral therapy, ART. So the most important measure of the efficacy of antiretroviral therapy is viral load. It is not CD4 count. This is what you have to understand. So if viral load is more, CD4 will be less. Okay. Virus itself is so high, CD4 definitely will be low. So our viral load should be less. How less? Less than 1000 copies per ml in HIV. You should say it should be less than 1000 copies per ml. Okay. That is a good thing. You should write that. So we are telling you specifics. So before starting the treatment, you will measure the viral load in HIV. You have confirmed that this person has HIV. Then what will you do? You will check the viral load, and based on the viral load, you will decide which treatment to give. Okay. So prior viral load you will measure. You should decide which drug to give. We will come to the drugs, and then once you give the regimen, for within the month, okay, after 1 month, they are saying you check the viral load. There should be a tenfold, at least a tenfold decrease in the viral load. At least a tenfold decrease in the viral load should happen. Okay, and then every year you can check the every 6 months or every year you can check the viral load. Okay, so what they are telling, what is a good thing about viral load is it is independent of CD4 count. It will tell you the prognosis and the risk of transmission of the disease. And what will you do if the viral load is not decreasing? Then you will change the drug regimen, and after that again 1 month later you will check the viral load. Are you there with us? Okay. Okay. So viral load in HIV, it will help you choose the antiretroviral drugs. So which are the antiretroviral drugs? Let us look at it. So antiretroviral drugs that you should know: lamivudine, abacavir, emtricitabine, tenofovir. This is NRTI, nucleoside reverse transcriptase inhibitors. So you always have to keep this in mind. Reverse transcription you should stop. So reverse transcriptase inhibitor is there here. Here also from reverse transcriptase this is inhibiting, but this is non-nucleoside. This is nucleoside, this is non-nucleoside, but both are inhibiting what? The reverse transcriptase. So the important drugs: lamivudine, abacavir, emtricitabine, tenofovir. Here you should know rilpivirine. Then in protease inhibitors, that is some enzyme, so you can stop the bacteria. In that you should know darunavir. And then integrase inhibitor is very good in reducing the viral load. This is what you have to focus on now. If the viral load is very, very high, more than a lakh possibly, or something like that, please look at the guidelines effectively. But if the viral load is high, then they are talking about using integrase inhibitors like dolutegravir, bictegravir. These names you should know, which are marked in green, because they are more commonly used. The ones in red are toxic and they are not used as first line. So let's look at the drugs again. NRTI, lamivudine, abacavir, emtricitabine, tenofovir. NNRTI, rilpivirine. Protease inhibitor, darunavir. Integrase inhibitor, very important if the viral load is high. Dolutegravir, bictegravir. Okay, gravir, all gravirs. All gravirs. Okay. Integrase inhibitors. Okay, very important. Integrase inhibitors. Okay, dolutegravir, bictegravir. Okay, the sample looks like raltegravir. Okay, gravir, you remember. Dolutegravir, very important, guys. Remember those names. So you will choose the drug therapy. Then you will check the effectiveness of the drug. Also, you will check if the patient is adhering to the regimen. And what did we say it should be? It should be less than 1000. It should be less than 1000 copies per ml after 1 month. Okay. Then this will also tell you about the transmission of the virus to others, the risk of transmission, the risk of transmission to others. Okay. Can you reduce this risk? Okay. That's what you are checking. Then pregnant, if the person is pregnant, then you should possibly, based on the viral load, you will plan the C-section. Okay, if viral load is high, they seem to be preferring a C-section. Guys, pay attention here. This viral load also helps if the patient is pregnant to know whether they need to plan a elective C-section. And we'll come to this. And then if the once this delivery happens via C-section or normal delivery, breastfeeding should we avoid or not? Again, the viral load will decide. Now, what will you do if the patient is pregnant? See, if you don't know the viral load, is it suppressed or not? If you don't know, or if the viral load is not suppressed, right? That time, what will you do? Near time of delivery, at this time, if you don't know the viral load, or if you're thinking it is not suppressed, then you plan a cesarean delivery, and for the newborn, they are giving ART. Okay. Then, during the cesarean, what they are saying is they are planning to give zidovudine intravenously. You just can look at all the details here. And till the cord clamping, until cord clamping, they are giving zidovudine 3 hours before cesarean, and continued through the surgery until cord clamping, they are giving zidovudine. Okay, guys. Then otherwise they are thinking about normal, they are saying. But zidovudine, guys, it's here. NRTI, nucleoside reverse transcriptase inhibitor. This is looking like they are giving IV during the C-section. Okay. Until cord clamping. You understood, guys? Zidovudine also you can mark and learn about it. Fine. So let's go back here. So viral load they have asked, and how is it used in HIV? Viral load we have explained in general for all types of virus, and for HIV you will say that it will help you to choose the drug, antiretroviral drug. You can choose integrase inhibitors like dolutegravir, bictegravir. Okay, all these integrase inhibitors, gravirs, bictegravir, dolutegravir. Then once you start the drug, after 1 month, you will check the viral load again. There should be 10 times decrease. If there is no decrease, then the drug is not effective or the patient did not adhere. And it should not be more than 1000 copies per ml. Okay. There should be a 10-fold decrease. That's what they said, right? Anything greater than 1000, they're considering it as a high viral load, you can say, or not a suppressed one. That's what they're saying. Greater than 1 lakh, they're saying it is a high viral load actually. Then if the viral load is less, then it says there is less risk of transmission to others. If the patient is pregnant with high viral load and during the the delivery, or if you don't know the viral load at all, then they are planning a C-section, and they're giving zidovudine during 3 hours before, during the C-section, and until cord clamping, zidovudine, remember. And breastfeeding, they are planning to avoid based on the viral load. Okay, that's all guys. Thank you.